All right, we are so glad that he's joining us today, Jed. You know, heel pain is an extremely common complaint, and there are several common causes, but it's important to make an accurate diagnosis of the cause of your symptoms so that you receive the right treatment. And we are glad that Dr. Kraus is joining us now with more on this. How common is this? Is this something you see a lot of in your office?
I probably see, I'd say 30% of my patients are heel pain patients. It's real common.
So that's a big problem. And what are some, let's look at some of the main causes when it comes to heel pain. And let's put those up on the screen, and I'll let you explain to people what this is and what these causes mean.
Plantar fasciitis is actually an inflammation of the ligament on the bottom of the foot. We don't know exactly what necessarily causes it. We think it's what's called a biomechanical problem, which means the way the foot functions. The heel spur is not necessarily something that's always going to be painful. A heel spur is a bony growth that usually comes from inflammation of that plantar fascia continuing to pull. So we have some patients that have heel pain and they think, oh, well, I looked online and I have a heel spur and there's an x-ray, and then they have no heel spur. And then there are other patients that have heel spurs just because it's an abnormal bony growth that actually doesn't cause any pain. I think you had a couple of other things up there.
Yeah,
there
we
was,
did, and the other one was tarsal tunnel.
Tarsal tunnel is a compression of the posterior tibial nerve. It's a nerve that actually goes into the foot, and it can cause sensations, pins and needles, and pain on the bottom of the feet. So it's a very common problem, and stress fractures. Normally, if you saw a stress fracture, it would be in the calcaneus. That would cause that type of pain. A stress fracture is not what people would think is a through-and-through fracture. It comes from stress, and it develops like what we call a stress riser in the bone. So I think that those are some of the more common causes of heel pain.
Now, you know, what about, should you seek treatment? Or some people are saying, well, maybe it's not that, you know, much. I can live with it. I can treat it myself. When do you know the difference?
You know, it's very funny. When I moved to Tennessee 21 years ago, I never heard the term stone bruise before. You know, when I was in podiatry school and when I was in my residency, it was always, people described it differently. But most people wake up here and they'll come into me and they say, Dr. Kraus, I've got a stone bruise. And I think a lot of people try to treat things on their own. I think that when it's okay to try and do that. You know, if you buy an over-the-counter insert or orthotic, if you try doing some home stretching exercises and you buy a good pair of shoes and you've tried some anti-inflammatory medication and it's not getting any better and it's becoming more of a chronic problem, you need to go see somebody and get it treated.
If it persists, yeah, it lasts. And we're out of time, but quickly, treatment. I heard you say something about stretches, and we've talked about that before. What are the main methods of treatment?
You know, stretches, injection therapy, anti-inflammatory, physical therapy, long-term care is an orthotic, which is a custom molded arch support. And then there's also the new treatments of the high-intensity shockwave or acoustic shockwave therapy. We're one of the only practices in the area that are performing that. It is a non-invasive treatment for this condition. I think there are a lot of good options. 90 to 92% of the patients get better, so get it treated.
All right, as always, thanks so much. We appreciate you coming in.